Welcome back to the Deep Dive. Today we are strapping in for a really thorough tour of the body's most essential and I think maybe most underrated machinery,
I would agree with that.
the gastrointestinal system or, the GI system.
Right.
And if you want a genuine shortcut to understanding the complex actions of, well, every gut medication out there, or if you just need to grasp the foundational science behind GI nursing care, this is it. This is your prerequisite.
It absolutely is. I mean, the GI tract is fascinating. It's the only body system that's continuously open to the external environment.
That's such an interesting way to think about it.
It really is. It runs uninterrupted from mouth to anus.
Yeah.
So think of it less like an internal organ and more like a continuous specialized tube that has to interact with the outside world.
And process everything we throw at it.
Exactly. So our mission today is to map its structure and really understand its 4 essential jobs: secretion, absorption, digestion, and motility. And then we'll get into the delicate network of controls that keeps this whole highway running.
Yeah, and focusing on those 4 activities is so key. They really define the whole workload. You've got secretion, which is adding the vital fluids. Digestion, which is the complex chemical breakdown. Absorption is, pulling the fuel out.
And then motility.
And motility is the coordinated push to move everything along the track.
So let's start with that basic architecture. We have the central tube mouth, esophagus, stomach, small intestine, large intestine, but it can't function without its support crew.
The accessory organs.
The accessory organs.
Right, so if the small intestine is like the main factory floor, then the liver, gallbladder, and pancreas are supplying all the chemicals.
Exactly.
The liver makes the bile, which is just essential for breaking down fats. The gallbladder's job is to store and concentrate it.
And the pancreas, the great neutralizer.
It really is. It sends in huge volumes of sodium bicarbonate to handle that strong stomach acid, plus all the key digestive enzymes.
And if this whole thing is a tube open to the outside world and it's full of food and our necessary bacteria, our normal flora,
Then protection is priority number 1.
priority number 1.
Uh,
So what keeps the bad stuff in? Well, it's not just the lining of the tube, but also these specialized structures like the greater and lesser omenta.
oh, this is a great visual.
There's sheets of tissue hanging from the stomach, and they act almost like nature's immune apron. They're just packed with lymph nodes ready to go.
That's fascinating. So let's zoom in on the wall of the tube itself. It's not just one layer, right? It's 4.
4 critical layers. The innermost is the mucosa. It's the lining.
And as clinicians, we know its health just reflects the entire system. If you see a dry mouth or lesions, that tells you the whole digestive highway is probably compromised.
Moving out from there, you get to the muscles, the muscularis mucosa. Now, for most of the tract, you have 2 layers working together: circular to squeeze and horizontal to move things forward.
But the stomach is special.
The stomach is special. It needs that churning action, so it adds a 3rd unique oblique muscle layer. This is what lets it physically grind food into chyme.
And it doesn't need to wait for the brain to tell it what to do.
No, not at all.
The nerve plexus, this huge network of nerve fibers embedded right there in the wall, it lets the GI tract operate locally. It manages its own reflexes based on what's physically in the tube.
Right. And the final layer is just the supportive outer coating, the adventitia. So the structure really tells the story. The whole tube is built tough, it's layered for movement, chemically assisted, and it's capable of its own local control.
All right, let's jump into those major activities: secretion and digestion. It starts in the mouth with saliva, you get lubrication, some early enzymes.
But the real show starts in the stomach.
It really does. And what's so interesting is the preparation starts before the food even arrives. That cephalic phase.
The sight, the smell, the taste.
It triggers that early secretion.
And once food does arrive, the mechanism is, well, it's complex, but it is so important for pharmacology. The goal is to flood the stomach with hydrochloric acid, or HCl. So G cells release a hormone called gastrin, which stimulates acid release. The parasympathetic vagal nerve also stimulates it, but the big target for our drugs is the 3rd pathway.
Ah.
Specialized cells secrete histamine, which then hits the H2 receptors on those acid-producing parietal cells.
So if we know histamine is a key driver for acid production, what's the immediate pharmacological insight there?
Well, precisely. The moment you understand that mechanism, you know how to treat excess acid. You either block those H2 receptors, that's your H2 blockers, or you block the final proton pump that physically dumps the acid into the stomach.
And the clinical relevance is just immediate.
Yeah.
Peptic ulcers are basically a failure of that balance between protective mucus and destructive acid.
Exactly.
So as that acidic chyme moves out of the stomach, The small intestine has to neutralize it fast. That's where secretion comes in.
Right, it stimulates the pancreas to just dump in all that sodium bicarbonate.
And if the meal was fatty,
If it was fatty, the small intestine cues the gallbladder to release bile. And bile, you can think of it like a detergent. It breaks up big fat globules into tiny droplets so the enzymes can actually work on them.
and if the gallbladder takes too much water out while it's storing the bile.
Then it concentrates and crystallizes, and that's how you get gallstones.
Okay, so digestion is pretty much complete at this point. Saliva started it, the stomach churned it, bile and pancreatic enzymes finished the job. So now we move to absorption.
And the small intestine is the undisputed champion of absorption. It's all because of that immense surface area from the long villi.
And it absorbs a staggering amount.
It's unbelievable. It actively removes water, nutrients, and elements. Something like 8,500 milliliters every single day.
But the absorbed products don't just go straight into your bloodstream, right? They go through the portal system.
Directly to the liver. The
Yeah.
liver is the body's main processing plant. It has to filter toxins, clear debris, and metabolize everything before it can enter systemic circulation.
And the large intestine is kind of the cleanup crew.
That's a perfect way to put it. It's primarily just absorbing the last 350 milliliters or so of water and sodium.
Which brings us to the last major activity, motility.
The mechanisms of movement. So that built-in nerve plexus we talked about maintains a constant muscle tone through something called the basic electrical rhythm, the BER.
You could think of the BER as like an underlying pacemaker.
It's the gut's pacemaker. It sets the pace, and the movement changes based on where you are. In the esophagus, it's peristalsis.
That constant forward wave, like squeezing toothpaste out of the tube.
Exactly. But in the small intestine, it's different. It's segmentation.
Right.
This movement alternates between contraction and relaxation. It's like a washing machine, tumbling and mixing the contents to maximize that contact time with the absorptive surface.
And that's what you're listening for. When you put your stethoscope on the abdomen, you're hearing that baseline activity.
About 11 contractions a minute, yeah.
The large intestine, though, that uses mass movement.
A massive, slow, once or twice a day peristaltic wave. It's designed to just propel everything toward the rectum.
And when the rectum gets distended, it triggers the defecation reflex, which, we eventually learn to control via that external sphincter.
So while the gut's own nerve plexus handles all the local issues, the autonomic nervous system, the ANS, provides that high-level input. It tells the gut whether to run or to pause.
So in fight or flight mode, the sympathetic system just slams the brakes.
Slams the brakes, decreased muscle tone, decreased secretions, and increased sphincter tone. Digestion is paused. Survival comes first.
But during rest and digest,
The parasympathetic system takes over. It steps on the gas. Increased tone, increased secretions, and critically decreased sphincter tone makes movement much easier.
what's just as fascinating are the local gastrointestinal reflexes. How the stomach tells the colon what's coming.
We rely on these preparatory reflexes all the time.
So if your stomach stretches, the gastrocolic reflex increases activity in your colon.
And clinically, we use this knowledge constantly. You can encourage a bowel movement just by stimulating the stomach, which uses this reflex,
Hot drinks, prune juice.
or just making sure a patient has privacy and time after breakfast. We're leveraging the system's own built-in communication.
But not all these connections are preparatory. Some are inhibitory. They slow things down in really unexpected ways. Tell us about the ileogastric reflex.
This is a massive clinical takeaway. If you have stretching in the large intestine, say, from severe constipation, it actually sends a signal that slows down stomach activity.
Which is why severely constipated patients often lose their appetite.
Exactly. The body is saying, I can't process more food right now.
And the physical world can inhibit these reflexes too.
Yeah.
The seminointestinal reflex shows that taut stretching of the skin and muscles over the abdomen actually slows the GI tract down.
It was first observed with those restrictive corsets historically, but even today, overly tight clothing or girdles can be a subtle cause of chronic constipation.
Wow. Okay, so finally we get to the centralized safety features, the ones governed by the medulla, swallowing and vomiting.
Right. And swallowing is an incredibly complex reflex. It involves over 25 muscle pairs.
And it's triggered by pressure receptors in the throat. The medulla just orchestrates this whole sequence.
The airway closes, respiration stops for a second, and the pharyngeal muscles contract to force the food bolus down.
And for patients who have trouble with swallowing, dysphagia, we can actually help trigger this reflex without drugs.
Simple things like icing the tongue or providing varied temperatures and textures can increase that sensory input and just facilitate that crucial sequence.
Then there's the final protective reflex, Vomiting.
Removing toxic substances. The control center is the medulla, but we have to differentiate between two zones there. There's the primitive emetic zone, which causes that uncontrolled projectile vomiting you see with brain injury or pressure.
But the one that's most relevant for us is the Chemoreceptor Trigger Zone, the CTZ.
The CTZ, yes. This is activated by a huge range of things. Motion sickness, severe pain, excessive stomach stretching, increased intracranial pressure.
And critically, direct chemical stimulation.
From drugs like chemotherapy or radiation, absolutely.
And the process itself is preparatory.
It is. You get increased salivation, sweating, you take a deep breath, the sphincters relax, and that final action is a protective backward peristalsis or retching if the stomach's already empty.
And understanding those triggers is everything, because the CTZ is what we so often target with antiemetic drugs.
Exactly.
So what we've really seen here is that the GI tract is, it's a complex, sensitive, self-regulating ecosystem.
It's a highway.
It's a highway designed for nutrient extraction, and it's governed by this unbelievably complex interplay of local communication, the ANS, and these powerful central reflexes in the medulla.
And that complexity, I think, brings us to our final thought for you. Given how easily this entire system can be manipulated or stalled by something as simple as emotional stress.
Or tight clothing.
Or tight clothing, or irritation from a foreign substance, how crucial is absolute precision when we introduce any external agent like a medication into this delicately balanced environment?
That's such a critical point. We have to consider the fragility of this whole machine before we ever try to modulate its function.
We really do.
Essential knowledge. Thank you for diving deep into the system with us. We'll catch you next time.